So you go to your annual exam with your gynecologist and everything feels fine. And then you realize, you think to yourself at home, did my doctor even do a pap smear? And then you're wondering, did they forget? Did they skip something? The answer might actually be no. And today I'm going to tell you exactly why. Hello and welcome to For Vaginas Only, the podcast about everything female. I'm your host, Dr. Celestine, bringing you important information about understanding your health and body in the way you wish your doctor would actually explain it. I am Dr. Celestine. I am a board-certified obstetrician and gynecologist who has been practicing for over 10 years now. And I'm going to talk today about what is exactly included in your annual exam and why a pap smear may not be on the agenda at all, and also about some things having to do with HPV testing and cervical cancer screening that most people have never heard. So first and foremost, let's go over what exactly is the annual exam. So we refer to it as the well woman visit, and that's because it's termed this way because it's comprehensive. It's a comprehensive check-in, not just your pap smear. So I'm gonna walk you through exactly what is included in this well woman annual visit. First and foremost, it's a pelvic exam. So there's a visual part of the exam and a manual assessment of the vagina, the cervix, the uterus, and the ovaries. And we can pick up on things by feel and by sight that a lab test would not catch or catch late. I also can see abnormal discharge, lesions, tenderness, size or shape changes. All of that is assessed here. And then there's also the clinical breast exam, feeling for lumps, feeling for asymmetry, lymph node changes. Again, not a replacement for a mammogram, which we'll talk about mammograms in a different episode, but it's still an important piece. So there's also the conversation, and this is really important. Any new symptoms, any changes in your cycle, sexual health concerns, mental health concerns, stress, birth control, perimenopause, libido, all of this is what we talk about in the visit too. It might lead to a new visit after that one, but it's very important, this conversation piece. So seeing your gynecologist every year matters, even when the pap smear isn't due. And that's because the exam is so much more than just that one test, okay? Now let's talk about the test. So let's talk about the pap smear and the whole schedule behind it. So I'm gonna walk you through some of the guidelines that your OBGYN will follow, okay? So when you are under 30 years old, usually the pap smear is done alone every 3 years, and that's just testing the cells of the cervix, if they are normal or not. There is a co-test where you can do a pap and a HPV testing together, but that's normally not recommended for those under 30 years old. And that's because HPV is so common under 30 that testing for it frequently leads to a lot of unnecessary anxiety and unnecessary procedures, okay? And it can go away on its own in 2 to 3 years if you're just healthy and not a smoker. When you're over 30 years old, you can do just the pap by itself every 3 years, but more commonly we do co-testing, which is the HPV test and the pap cellular test together every 5 years if it's normal, okay? So this is the exception. If your pap has ever been abnormal or not normal, this schedule does not apply to you. So let's say you've had a LEEP, cryotherapy, cold knife cone. If any of those things have happened recently, you need 2 consecutive paps, each a year apart, that are normal before you can go back to this spaced out schedule. So you're on a kind of surveillance, shorter term schedule for a little while until we confirm that the HPV is gone, okay? So again, 2 normal paps in a row, 2 years in a row. That's your ticket back to the longer, more spaced out interval of pap smears. Now let's talk about HPV testing and a little bit about what's new, okay? So there's primary HPV testing versus co-testing. So primary HPV testing by itself or a combination. Co-testing, like I talked about, is the pap and HPV test together, been the gold standard for years for many patients over 30 years old. Primary HPV testing by itself, that means no pap is included, okay? And that is FDA approved now as an alternative. And the reason behind it is because HPV virtually causes all of the cervical cancer types, so catching it early is powerful. However, if HPV is detected, then a pap is normally done as a reflex test anyway with your doctor. Now, there is at-home HPV testing, So there are new products on the market where you can do this little swab at home. You can mail it in either to a testing facility or your doctor's office. And it is great for especially people that have barriers to getting tested, like cost barriers, transportation issues, anxiety around exams, or trauma history. So I think it's a great tool. However, even though it's getting more people screened, you still have to know that a positive result still means you need to go to see your doctor. And even a negative result doesn't mean you skip your annual exam, right? We talked about the pelvic exam, the breast exam, and the conversation piece, which I think is probably one of the most important parts of the exam, to be honest. Now, let's talk about HPV. So there's high-risk strains and there's low-risk strains. Not all HPV is the same. There are hundreds of types, but we have numbered them. 16 and 18 are the more high-risk strains, more or less connected to cervical cancer, vulvar, anal cancer, throat cancer. Low-risk strains, number 6 and 11, are more associated with genital warts and not necessarily cancer. The at-home and tests for HPV in the office test for the high-risk strains, most of them. So a negative test does not mean you never had HPV. It means you don't have these high-risk strains that can lead to cervical cancer. So when it comes to HPV as well, you have to know that it's a virus that's pretty common. About 70% of people encounter it in some part of their life. And it can go away on its own if you stay relatively healthy and you're not a smoker of any nicotine products, okay? So that's why we can sometimes just follow it closely. It doesn't always lead to cancer. Now, I think what a pap smear does not tell you is actually as important as what it tells you. So a pap smear screens for cervical cancer and precancerous cells of the cervix, okay? It does not screen for things like ovarian cancer. There's not even a routine test for ovarian cancer. Symptoms are usually the first sign. So even people that ask for routine ultrasounds for ovarian cancer history in a family member or just for general concern, it's not a standard of early detection, okay? It's not used for that. A pap smear is also not going to tell me if you have, most of the time, there's a nuance, but it will not tell me if you have uterine or what we call endometrial cancer, okay? That kind of cancer usually starts with abnormal uterine bleeding, so heavy bleeding that comes out of nowhere, or if you're postmenopausal and then you have bleeding again, that's not your period. It's usually something that at least needs to be investigated, okay? It will also not test you for STIs. So the gonorrhea, chlamydia, trichomonas, herpes, that is not on a pap smear. We can add it in, some of them, but that's not routinely done. You have to ask for that, okay? So when you come in and you're saying, oh, I have my pap smear and it's normal, it's not just a green light for your entire reproductive system. There's a lot of other things that we look at and we check at your annual exam, and the pap is one piece of that. Important piece, but just one piece. So I have a lot of people come to my office and they say, my pap has been normal, and that means I'm healthy with all of that stuff going on down there, you know. And that's not necessarily true. It's an important piece of the exam, but it's not the whole exam, okay? But it is something that does matter. So I'm gonna give you some work to do, some actionable steps, as I call it. I want you to pull up your last pap result, whether you have to call your doctor's office or look through your online portal and check the date. If you have had an abnormal pap smear or any treatments for the cervix, I want you to confirm with your doctor what schedule for pap smears you are actually on. And next step, I want you to ask at your next visit, am I on the right screening schedule for me? And if you've ever been curious about at-home HPV testing, it is a valid option for some people, so that is great, but don't use it to skip your annual because there's lots of other important parts to the yearly checkup, okay? And if you've ever gotten a surprise bill after what you thought was your routine checkup annual exam, then I want you to stay tuned for the next 4 Vaginas Only episode because we're gonna break down exactly how that happens and the words you can say before and after your appointment to protect yourself, okay? So thank you guys so much for listening. I am Dr. Celestine. This has been the 4 Vaginas Only podcast. And make sure you share this with someone that you know that can learn a little bit about the annual exam and about the pap test, whether it's needed or not. I'll see you guys next time on the next podcast episode. Bye.